Right. Well, good afternoon, everyone. Welcome to the Child Care Capacity Accelerator Innovations Community webinar. We are recording today's webinar and it will be posted on the All In for Kansas Kids website later this week. My name is Megan Kluth. I work for the University of Kansas Center for Public Partnerships and Research, and I'm joined today by my colleagues Sarah Gardner and Julie Herzog. So we're going to provide an overview of the innovations community and how that is connected to the Child Care Capacity Accelerator application, what the actual application process is, and then we have several resources that are available to you as you consider if you want to apply for this. We should have plenty of time for questions, and feel free to put those questions in the chat as we go or hold them to the end. Either way, we'll keep an eye on the chat and can stop and answer questions as you have them. So just to reorient everybody a little bit. So, several of you may have been on the previous webinars about the Child Care Capacity Accelerator, and just want to clarify how the innovations community fits in as an optional add-on within that application. If you need a refresher, there are several recordings of those webinars about the Capacity Accelerator and how to apply for that on the All In website as well. And we'll be putting links to that in the chat throughout, so you can kind of everything related to these funding opportunities is on that site in one place. So just probably a good thing for you to bookmark if you haven't already. But just as a reminder, the purpose of the Child Care Capacity Accelerator and the community grant is really to create additional licensed childcare seats across Kansas, and that can be done through a number of ways. And so the innovation communities is an optional add-on within that application, and we'll talk a little bit more about what that means, but just want to make sure it's very clear that it is an element within and not a separate funding opportunity. So the innovation communities add-on, this was announced in response to hearing there's a lot of exciting and unique ideas that we've heard from you and from communities across Kansas looking to solve for childcare gaps. And so this initiative was developed as an optional add-on request for the Child Care Capacity Accelerator. Anybody who is applying for the Child Care Capacity Accelerator grant is eligible to apply for innovation communities, but you must be applying within the Child Care Capacity Accelerator. So I know that can feel a little bit confusing. They're not quite one and the same, but they are very much connected. So think of the innovation communities as an optional layer within the Capacity Accelerator application. And we're going to talk more about how this is actually embedded in the application later. But just wanted to make sure that's clear. So the goal of both is to increase licensed childcare slots throughout Kansas. Within the innovation communities, there is the additional element of communities will select an innovation category and an innovation strategy within that to implement some different ideas, recognizing there's really not one size fits all for addressing childcare. And this is a chance for communities to say, here's what our local needs are, and here's what makes sense based on our population, based on the partnerships we have in place. And so this is designed to be a little bit of room for you to be able to try some things and hopefully increase childcare access along the way. And there will be plenty of support for those that are awarded, which we'll talk about here shortly. So we're going to talk now about the innovation categories. And again, these materials are all listed on the All In for Kansas Kids website, which we'll link. But we wanted to just make sure it's clear and also give people time to kind of think about what this might look like if you're considering applying in your area. So there are 6 innovation approach categories: infant toddler incentives, childcare plus models, workforce recruitment and retention, non-traditional service hours or targeted populations, rural childcare, and public-private funding partnerships. We're going to walk through each one of those and talk a little bit more about what those mean here in just a minute. But just want to be clear on what the actual categories are. Those are set, so applicants need to pick within there And you can select up to 2 categories. One is just fine as well. But again, we'll walk through what strategies within that and some examples are, and that's, we'll do that now, but it's also listed on that innovations guidelines overview document if you need a refresher after today. So there's 6 categories. Applicants can choose up to 2. And then within each category, you can propose 1 implementation strategy. So we're going to try to walk through that, make sure it's really clear, because I know it can be a little bit confusing with what's a category versus a strategy. So want to make sure that makes sense to everybody. And also want to note that as we get into these categories and these strategies, you'll see these are really ideas. There's potential ways that you might be able to implement within the category. You'll also see some model examples that we've found from across the country. None of these are required, nor are they endorsed. They're really just ideas to help kind of provide a little inspiration of, oh, maybe something like that could work in our community. So the only thing that's really set in stone is those 6 categories, but there is room for you to think about like what's the best approach, knowing the area the way that you do. Okay. So the first innovation category is infant toddler incentives. I think we know that this is often a gap area for many communities. And so the purpose of this category is for communities to find ways to increase license slots for infants and toddlers without passing those costs directly to families. So that may very well be something like a multi-payer model. There may be other approaches to that. We have the benefit of having a unique pilot going on within Kansas right now that may be a beneficial resource for you to consider if you're interested in applying for the infant and toddler incentive category. Child Care Aware of Kansas is currently doing a pilot in 10 counties. They're working within the Patterson Family Foundation catchment area currently, but they're looking to expand in other rural areas as well. And it's essentially they're using grant funding to pilot ways to increase infant toddler slots through basically having that additional funding to help offset the cost. And the goals of the pilot that they're working on is really to make infant toddler slots a little bit more financially feasible for providers to increase them, again, with the goal of not then having to, increase family payments. So trying to offset that, but also make sure that it's, positions providers well to be able to increase their numbers. Additionally, it's working with family childcare providers to try to provide additional revenue opportunities for them. And then to help connect them within the early childhood system, make sure that providers know what resources are available as they're supporting more infants and toddlers. So if you're interested in learning more about this pilot, Child Care Aware of Kansas has generally offered to connect with people if they want to hear more, particularly those who might be interested in either in learning more about what they're doing in rural communities, but also if you're in an urban area, even though that's not where the focus of this pilot is, they've generously offered to connect with people to brainstorm how might you be able to roll something else like this out in your area. So would highly connect people that are interested to reach out to this email for Child Care Aware and learn a little bit more. And then we also have another, again, you'll see on each of these additional strategy example. We tried to pull these from across the country. So just other ways that people have tried to go about increasing infant toddler slots that may or may not be helpful for you. Okay, our next category is Child Care Plus models. And the purpose of this category is to leverage childcare within other community spaces, other community partnerships. So recognizing that it could be childcare is being provided literally under the same roof as some other social services, other types of care settings, other things like that. It could also be community partnerships to share resources such as cross-training staff or sharing meal preparation areas or custodial services, things like that. So it literally means childcare plus, and then fill in the blank. That may mean a lot of different things to different communities. But looking at how can childcare kind of fit into either spaces where families may already be going, or how can you potentially leverage some collaboration opportunities to support, the financial operations of providing childcare, the staffing needs, all of that. And the example we have here is from California, and this is a multi-generational childcare and preschool program out of the Los Angeles area. And again, if you have any questions throughout this, I know it's a lot of information, please feel free to go ahead and put them in the chat and we can stop and talk through them, or we will have plenty of time at the end.
Megan, to that point, there is one question that I think goes back to how many categories, strategies, etc. The question is, can categories be combined? Example, workforce recruitment and public-private partnerships, or do they need to remain separate?
That's a great question. Thanks, Sarah. No, the short answer is no, they can't be combined, though we recognize there could very well be some overlap between them. I think you're going to see that as we get into these, that there are some where I think a substitute provider pool is a great example, which is something we're going to talk about in a minute. That could fall under the workforce recruitment and retention, but it could also maybe fall under childcare plus models, depending on how you set it up. So the short answer is no, but I think there's some wiggle room in terms of how you're interpreting what those categories might mean. And I think that would be a great example of let's have a conversation about what you think might make the most sense. We're going to talk about the technical assistance that's available shortly, but we do want to keep pretty strict parameters around those 6 categories, but there's definitely more wiggle room within the strategies, and a lot of these things there's a lot of gray area. So I would say think about what you feel like is the best fit, and if you're not sure, reach out and we can talk through where it might make the most sense for you to fall. But no, you're not able to actually combine them. So, but you can apply for 2 if you want to. So again, it may be easier to talk through that on a case-by-case basis, but that's a great question.
Megan, does it make sense to maybe explain why we're being a little bit rigid, perhaps on the reason for that? There is a reason for that.
There is a reason for that. Yeah, absolutely. There is a reason for that. And it's really, we feel like this is a great opportunity to evaluate and really try to document which of these strategies are most effective in terms of increasing childcare access in Kansas, recognizing there's a lot of different ways to do that. But it's really from an evaluation standpoint of how can we try to control as many factors as we can, which is kind of where that rigidity around the categories is coming in, so that we can look at the ideal outcome is that we can look at, we had 3 communities trying to increase infant toddler slots, and because we saw that they had X, Y, and Z factors in place with these approaches, that we can really kind of have a clearer vision of, was that successful or was there something else we needed to know? So I think we've tried to build in flexibility where we can, recognizing that you all know your communities better than anybody else. And that, again, the whole point of this is there is no one size fits all. But we've identified these 6 categories as we think these are areas that across the state can really be very beneficial to coming up with a broad variety of approaches to increasing childcare access. Are there any other questions in the chat at this point? I'm not able to see that.
Right now, there's not, Megan.
Okay, perfect. Well, please throw them in as you think of them. And if you are kind of saying, oh, I have a little bit of an idea developed, you're in the right place. We want to make sure that you have plenty of time today and leading up to the application deadline to be thinking through all of that. Okay. Our next category is a big one, in that I think many of us know this is an ongoing challenge. It is workforce recruitment and retention. And so the whole purpose of this category is to build or strengthen a sustainable local childcare workforce. We know that childcare can't work if we don't have strong workforce. So I will note that these approaches should be in addition to a compensation plan. It is strongly recommended for applicants to be providing a living wage for providers and to have a compensation plan in place. And so this is really what are additional strategies and beyond compensation. So things like a substitute provider pool, potentially cross-training staff. We talked in the last in Childcare Plus about like multi-generational care models or leveraging care providers from other settings. I think this is where an example of where that could qualify in either category. So is there an opportunity to do some cross-training among staff and in your community that are serving different populations? Other examples of this could be trying to augment your workforce through opportunities for volunteers, for mentorship and apprenticeship for your childcare providers to have some professional development opportunities, return to workforce. Maybe there are childcare providers that, or people from similar fields that have decided, you know what, I'd actually really like to come back to the workforce, part-time, full-time. How might they be able to be leveraged? So I think there's a lot of room for creativity in this one. Another one would be maybe you have local childcare providers that are interested in retiring or just ready to move to a different area of their lives. And what's the plan in place to make sure that that business ownership is able to be transferred so that those slots are still available for families? So we've got an example here from Washington and how they developed a state-supported substitute pool. I think I would say, I think there's room for creativity in all of these. I think this is probably the one where there's the biggest amount, just because there's so many different ways that communities may be able to go about this. And we know just from some of the things we've heard from potential applicants on the Child Care Capacity Accelerator that I think workforce is very much top of mind for people. So okay.
Megan, there's a question in the chat.
Sure.
I might ask Diane for you to clarify what you're asking here. If you don't mind coming off mute and asking, I'd appreciate it. Thanks.
Of course, not a problem. What I'm just wondering, in the workforce recruitment and retention category, it's workforce as in workforce recruitment for childcare providers and professionals, or instead of having adequate childcare, increased number of seats, etc., to recruit employers to the area and or for those employers to use as recruitment/retention tool for their employees?
That is a fantastic question, Diane. Thank you for asking that. I would say we have mostly been thinking about it from a childcare workforce, but certainly there are a lot of conversations going on with employers and recognizing that if your employees can't go to work because of childcare, that's also challenging for the community. So I think that's a really great example of, we have written these in a way that's again tried to allow that flexibility and creativity. We also want to hear that from you. So to be honest, I hadn't thought about it from that perspective, but I think it's a great thing to explore. So I would say, if you want to have a conversation about like what could that look like, we certainly can. But there's another category, again, like you're going to see there's some gray areas in here. There's another category where I could see the employer piece playing a role. But I think ultimately it's like, are there enough qualified, providers to actually make sure the childcare is there?
Sure.
As well as we want to make sure, how are families getting access to that? How are the people in the community that rely on that childcare knowing about the slots that are available? So it's a really good question. And I feel like I gave you a little bit of a non-answer, but I think it's a great opportunity to maybe see if there's a way to do both.
Okay. I will make myself a note that if we decide to pursue this, to set up a time to chat with y'all beforehand.
That sounds great. Appreciate it.
Awesome.
Thank you.
Thank you.
Okay. Any other questions on workforce? I know that's a big one. Okay. Well, if you think of them, we will have time. Okay, so we've got two more. Non-traditional service hours or targeted populations is essentially how do you increase access for higher needs populations that are typically underserved. So that might be offering hours for beyond 8 to 5 or kind of your typical business hours. So for people who work the third shift or people who potentially need 24-hour care. This could also be drop-in type care, emergency care, as well as increasing the number of seats for children with special healthcare needs, families that might speak a language other than English as their primary language, military families, anybody in your community that you're feeling like they're underserved, either through the lack of slots or the lack of time of day that they're able to get their care for. And so the example from here is from Iowa, and it's a 24/7 childcare center where their hours expanded because of the number of third shift workers needs. So we know there are many communities in Kansas where that is a high need based on common employers. And so would really encourage you to think about if you're in a community like that, where you're saying there's a population where there's a pretty big gap here, this might be a really good fit for you. Okay. Rural childcare. Again, we recognize there's a lot of opportunity to expand childcare access in rural communities, and that could be done through a lot of different strategies. So some of the example strategies could be sharing transportation to help, we hear a lot, families are traveling 30+ miles one way to get to a childcare provider that meets their needs in rural communities. So are there opportunities for reducing travel burden for either the family members or providers through transportation? Are there opportunities to kind of rotate childcare? Oh, there's a typo, sorry for that. Rotate childcare services between communities. The example we have is from Colorado, where they set up what they call rolling preschools. So they're literally mobile preschools that go community to community. This could also be sharing resources, services, staffing. So again, are there opportunities to share like meal preparation staff, accounting services, the indirect costs. So I think there's, again, a lot of room for creativity of what that might look like. But certainly if you are in a rural community, particularly one that might be interested in partnering in your region or in your county, this might be a good category for you to consider. And then last but not least is public-private funding partnerships. And so this is what it sounds like. Essentially, it's engaging an additional funder or funders for licensed childcare services. So Diane, I think this is potentially where the employers could come in, though that's not to say that they couldn't in the workforce piece. So this is who are the people that aren't typically payers for childcare in your community, which for us, we're considering those who are typically payers to be families, short-term grant funding opportunities, and childcare subsidies. So this might be, can employers actually sponsor childcare seats? Can they help set that up as a benefit for employees, saying, hey, we really want you to come here and work for us. We will, we could help fund your childcare. We could help make sure you have spots. We could help, pay for kind of the navigation support, whatever that might look like. This could also be a community fund, local grant makers, local businesses, chambers of commerce. We certainly know there have been a lot of conversations bubbling up across the state of what could these unique funding arrangements look like. And the example we have here is from Michigan, and they've set up what they call tri-share childcare, which is a three-payer system to childcare, with the goal of trying to increase sustainability and trying to make it financially feasible for providers, as well as not continuing to increase costs for families. So, okay, that is the 6 categories. I know it's a lot, but hopefully that gives you a little bit more idea of what we're looking for. But again, would highly encourage you to even if you're like, I'm not totally sure if this fits, let us know and let's talk through it and see if it might, because I think, again, you all know your communities and your needs and your assets better than anybody else. And so this is designed to be an opportunity within, you know, some rigid categories for you to be able to really think creatively and think about what kind of partnerships do you have in place that you might be able to try some things and just see how you can increase childcare access in different ways. Before I get into kind of the logistics of the application, are there any other questions regarding kind of the categories, strategies, anything we've covered so far? Okay. So the logistics, the timeline is we're doing the webinar today. Again, it'll be recorded and posted by the end of the week on the All In for Kansas Kids site. The application timeline, it is because it is rolled into the Childcare Capacity Accelerator. It is the same deadline, which is May 15th by 5 p.m. We have technical assistance, which we'll talk about in a minute, as well as informational calls available through May 14th. So right up until the end, we'll make award announcements. And again, this is the same for the Childcare Capacity Accelerator in June. And then the project period for the innovation communities is July 2023 to June 2024. That may or may not be the same timeline as what you're proposing for the Childcare Capacity Accelerator. It may be tighter. It is 1 year because of the funding source, which is a bit different than the Capacity Accelerator. So just wanted to call that out. It'll be clearly marked in your application and the way you set up budgets, but just in case anybody's saying, huh, that doesn't seem like it matches what I've been thinking for the accelerator, that is why. So we know it's tight, we know it's 12 months, and we'll be really intentional about setting up support along the way so that we can help people think through their projects. But just want to make that sure that people are really aware of that, because it is only 12 months. So just be thinking about that as you're considering, like, what could I really implement in that time frame. So we plan to fund up to 12 communities from the Childcare Capacity Accelerator grantees to participate in what we're calling the Innovation Communities Cohort. And we'll talk a little bit more about why we're calling it a cohort in just a minute. The maximum award amount for the innovation community, again, that add-on only, is $250,000. And that is really money to implement your strategies. So you will have a separate budget for the rest of your Childcare Capacity Accelerator application. You will then do a budget for the Innovation Communities project, and that $250,000 is specific to what will it take to implement your proposed strategy. Again, it's a 12-month grant period, so July of this year through June of next year. So the strategies would need to be fully implemented by that time. So just keep that in mind as you're considering what may be doable. And the reason we're calling it a cohort is because we have expectations, as well as things that we think, like, benefits this could provide for people that this might be a good fit for. But this is really intended to be a collaborative process. You know, we talked a little bit earlier about the evaluation and how can we help communities learn what's working in your local area to increase childcare access, what might be a really good long-term strategy, but also from the whole state, like, we can kind of have both the zoomed in, what's working at the community level, and then the bird's eye view of what are we learning from across communities? How can communities connect with each other as they're trying to solve similar challenges? So for the communities that are selected, the expectations are that you'll participate. We'll have kind of monthly or bi-monthly, what we're calling co-creation and peer learning sessions. This is really a chance for you to talk to other people that are on the ground trying to solve similar challenges and learn from each other. We'll also have some ongoing data reporting and evaluation efforts. We'll do like an orientation once people are awarded and kind of walk through what that means. And then we'll have innovation coaching sessions with each grantee monthly. And that's really, again, to just provide an extra layer of support as you're getting into these projects and helping you get them across the finish line and saying, hey, that's going really well, let's keep doing that. Or, we thought this was going to work and we kind of hit a hurdle, and how can we work together to talk through that? So we hope that those feel like benefits for you as well, to have an additional layer of support, but also want to be clear, it is a little bit of an extra time commitment if you're interested in applying for this, just so people know that going in. So the process for applying it's the same eligibility requirements as the Child Care Capacity Accelerator. Again, anybody who's applying for the Child Care Capacity Accelerator can apply, just with the expectation that then you implement at least one strategy from within those select innovation categories. There is a tab now on the Kansas Common App that says Innovation Communities. That is what you will fill out as your application. I will note that because it's not required for everybody who's applying for the Capacity Accelerator, it may show as like optional questions. If you are applying for the Innovation Communities, consider those required for you. We're going to walk through the elements in just a minute of what that is, but that's live now. So you can go in and actually see. There's a handful of questions, and then you'll also do a separate budget. So the questions that you'll see if you look at the innovation category, the Innovation Communities tab in the Kansas Common App, is you'll select up to your 2 innovation categories from a dropdown. You'll explain your proposed strategy within those categories. You'll talk a little bit about why you think it's a good fit for your community and how you're qualified. How are those strategies going to increase the number of licensed childcare slots? How does this align with your broader Child Care Accelerator project proposal? And then your total project request dollar amount. And then in the attachments tab on 2.1, you'll see an actual way to upload the separate project budget. So it's not super long, but it is its own category. And just a reminder, it may look like it's optional, but please just make sure you fill out everything if you are interested in being part of the innovation communities.
And Megan, there's a question in the chat, but I think you've answered it. Can you have a grant application that is just a proposal for the innovation community portion?
No. So you would need to apply for the broader, what we're calling you need to apply for the Child Care Capacity Accelerator. This is an element within. It is possible that like somebody could, actually that's going to make it more, I'm not even going to say it that way because that's going to make it more confusing. So no, I mean, you have to apply for both to be eligible. So I would definitely make sure that you take a look at the eligibility requirements for the Child Care Capacity Accelerator. Make sure that feels like a good fit because this is layered within it.
Megan, do you mind if I offer just some clarity from the accelerator side?
Not at all, please do.
Ideally, these strategies, because they are also intended to support the addition of slots, childcare slots in Kansas, that aligns with the accelerator. So these are supposed to, that's why it's an add-on and not a separate process, is because it's intended to have the same goal and the same outcome, just with a little bit more targeted approach. And keep in mind, you can ask for operational support only in the accelerator. You don't have to ask for construction if you don't need it. I would imagine a lot of folks who are thinking construction may not be thinking about this level of like targeted strategy. So, keep in mind, accelerator grants can be operational only if you're adding slots. That's really the key requirement. And I know there's a lot of questions on there. There's a lot of questions about fiscal agents and, what are you adding and what's your processes? Do you have a community champion? Do you have collaboration? There's a lot of questions in the accelerator. Answer as best you can, but we would encourage, even if you feel like, maybe you don't have everything, that maybe you're not the perfect candidate for the accelerator, still apply if you have the capacity to do so, because it helps us understand what the need is, and it also positions you to maybe get a lower score on the accelerator, but still have a really solid innovation community approach. And, we want to fund 12 good projects for the innovation communities. And so even though they're one in the same process, make sure you consider that as well.
Thanks, Sarah. I think, yeah, we recognize that this may be hope we're trying to not make it confusing, but there might be some different things for you to think through. So again, I'd really encourage you both with the Capacity Accelerator and the innovation communities to take advantage of the technical assistance. It is there leading up until the application. So I think this is a unique opportunity for any communities that are trying to increase childcare slots. So definitely want to make sure people do their due diligence to figure out if either or both of these is a good fit for you to apply. So we'll have the recording up. There are several recordings about the Childcare Capacity Accelerator already live on the All In for Kansas Kids site. So again, if you missed any of those, would definitely encourage you to take a look. We have FAQ documents for both the broader Childcare Capacity Accelerator as well as a separate one for the innovation communities. We have a document that outlines what we walked through with the 6 innovation categories, what potential implementation strategies might be. The Kansas Common App has the application itself, as well as kind of there's a resources tab within that. There's also, you may have seen some community planning and data resources for communities that want to know a little bit more about what does the childcare need look like in their area. That's also available on the All In for Kansas Kids site. And then probably the most important link for you to know is our technical assistance portal. This is the same for if you have a question about the Childcare Capacity Accelerator. There's also a drop down now for innovation communities. So any question you have about any of this, that link will work, and please use it. Like, it is there for a reason. We will respond to you as quickly as we can. So that could be kind of whatever question you might have, pretty general logistic question to, hey, is this, I'm kind of thinking about this idea, is this a good fit? And then we also will be available for informational, like one-on-one calls with people as they're trying to figure out, is this a good fit? We want to make sure this, we want to make sure this is a good use of your time and talk through like, what could that look like in your community? So you can submit a TA request to request one of those calls, and then we will figure out like a 30-minute slot to set up a phone or a Zoom call with you. And again, those are available leading up to the application, which is due May 15th. All right, we just threw a lot of information at you. So stop sharing and see if we have any questions.
I have a question, maybe. So we are opening a childcare in a school district. So like the cross-training staff, we're already going to be sharing the kitchen. We're already going to be sharing the custodian stuff. But they're not technically like childcare employees. They're under the district. Is that still considered like the childcare plus side?
Absolutely. I think ultimately the goal is to benefit childcare access. So that may or may not directly be your like childcare staff, but if those people are ultimately benefiting your ability to increase slots, then yes, I think you can have some wiggle room there.
I don't necessarily have a question, but I was wondering about the recruitment part of it. I have a couple of ideas, I guess. Should I save those for later? Or
I mean, it's up to you. We'd love to hear them, but I mean, if you're willing to share, absolutely.
okay. Well, I own the Kids World Child Care Center here in Wichita, Kansas. Right now, we're always short of staff. We have another daycare center, which is not too far from Wichita State University Daycare Center. And sometimes when we're low on staff, they'll send us one of their teachers, or we'll send them one of our teachers, just depending on, how many kids we have or whatever. That has been something we've brought up to our local surveyors, and they're considering that to be something that they'd like to implement within all the daycare centers here in the city, to where they'll be able to share staff since we're short on staffing. And I was also wondering about recruiting high school students. since, they go through, well, I don't know. It's been a while since I've been in school, but we used to do like a home ec type thing, and they teach you how to do childcare in high school. And then maybe those students would be interested in furthering that as far as working in the childcare center. And I wouldn't know how to get in touch with them or recruit them from that.
Yeah, I think both of those ideas, I think absolutely would fall into being under consideration for these. I think looking at, there may need to be some new approaches to, the workforce shortage is certainly nothing new, and we know it's an ongoing challenge. And so what are different and creative ways that you might be able to, find volunteers, find part-time workers, find full-time workers. And that may be people that really want to pursue this as a long-term career. And that may not be the case depending on the situation. So I think what you described, absolutely, those would be really good ideas to consider for this.
Margot, I'm going to send you a message. I'm Diane. I'm with Wichita State. So I'm going to send you a message with my contact info, and let's set up a time to chat here.
Yes, to echo Julie's comment, I think this is exactly you all talking to each other is as valuable as anything. So I think anybody who wants to share their ideas, or also if you're kind of saying, I'm really interested in this, but I need a partner, let us know that too. You can either share that here, or you can put a TA request in, because we might be hearing other people in your area that might be potentially really good partners for something. So truly don't be shy about submitting TA requests if there's something that could be helpful.
It's one of the really great things that I've always loved of working in the early childhood population and world is the collaboration that happens. Here we're learning about a grant opportunity, a funding opportunity to build accessibility or access to capacity in the communities, but you guys are already making connections with one another. So that, I think that speaks world in the early childhood world.
While you guys are thinking about your questions, another thing I want to point out is we take innovation really seriously in the sense that most innovations don't work out. Many innovations, quote unquote, fail. And there is nothing that at the end of this, if all of your ideas that you put out and all of the best efforts that we made don't work out, we still learn something from that, right? So I just want to encourage folks. I think we think innovation's like this high bar, that it has to be something super special and super unique. And the old saying, there are no new ideas, like that's really true. There's a lot of things that have been done or that can be done differently, or we can revisit and re-elevate. So give yourselves credit for the ideas that you have and the ways that you're thinking about addressing stuff, and don't consider that bar and that threshold to be so far that you can't reach it. We're here to support you, and the innovation coaches and the evaluation team is here to support you every month. And 3 months in, you say, I still haven't been able to do this. That's okay. We'll pivot. We'll help support. So that is, I think, the difference between this effort and maybe other grant funded projects where you get the grant, you go off on your own and you implement the strategy. This is really about how can you help other communities learn from what you're trying? That's really the main goal here.
Yeah, thanks for that clarification, Sarah. I think to add to that, this is really designed, within some parameters to give you a bit of a playground to try some things that we know. It's hard to get funding. I think we all get that. Like, it is hard to get funding, and nobody wants to go after funding where they're like, I don't know if this is going to work or not. But I think this is a unique grant opportunity. And also for those who are for the grantees that are awarded, like we're going to have conversations with you about sustainability. It's not for the innovation communities. It is not an expectation out the gate that you have a multi-year sustainability plan for the strategy. There are some sustainability elements within the broader Accelerator application. If it's working, absolutely, we will have a conversation about what does sustainability planning look like? How can you keep this going beyond the year? If it's not working, that's a different story. So I just want to be clear, because I think sometimes there's a very natural and hesitation for a good reason. Like sometimes you just don't want to try things. You're like, oh my gosh, I don't even know how I'm going to keep this going. That is less of a concern that we would want you to have for the innovation community. I think it's really like, do you think this could work? And if there's a chance, it's worth thinking about applying for this.
Megan, there's a question that just came up. I see some of the strategies could overlap. If we get into this and we need to change our strategy, is that okay? That's
a really good question. I think yes. I mean, to be honest, this is new for us too. So we're going to be figuring some of this out along the way. But my gut response to that is yes. And that I think that would probably look a little bit different case to case. So it may not be like a huge pivot, but again, like we don't want this to be, well, we tried one thing and it didn't work, and then we didn't have a conversation about it. Like if you're doing something and for whatever reason you're running into barriers or it's not working, we will have, because of the coaching that's going to be in place and the evaluation that's going to be in place, we will have time throughout the grant period to kind of say, how can we tweak that? So it may or may not be that you fully change strategies. I think that's more like semantics, but yes, I think there's room for pivots is probably the shortest answer for that. I just saw the coaching question. So right now our plan is monthly. Again, like I think we're going to have to kind of see how it goes, and it may be that some communities need more often. So we're going to do our best to be responsive to what you need. But I would say at minimum, at least for the first several months, monthly. And we'll kind of just see if that feels like the right frequency for people. We want it to feel supportive and not like an added burden to people, but also want to be clear, like, we do need like people to understand that there is an expectation of active participation, and it is a little bit of extra time. So that being said, I think there will be kind of a minimum threshold, and then there may be some communities that want a little bit more than that. All right, we'll give everybody just another minute in case you're thinking of any questions. And if not, then we can wrap up a little early.
One just came up. This is really exciting. Will the dollars allocated for this come from the same Accelerator grant pool?
No, it's a slightly different funding source. So no. Sarah, do you want to add anything to that?
I'd be happy to be super transparent. It's coming from our preschool development grant. So we have a third year of our implementation grant, and we have a new planning grant. So we're going to use some of that, and then a sliver from that DCF pot that is funding the accelerator, but it doesn't impact the resources available for the accelerator. So trying to take all the different dollars that we have available and make them accessible and usable for communities. Okay, I have to say one more thing because, yeah, that's me. We really want to celebrate these efforts, the boldness and the bravery and the courage that you would bring to this effort. We want to celebrate it. So just know that when you're going through the process, we will want to talk about your efforts and your work. So if you are someone who doesn't want any publicity at all for your project, probably not for you. We want to highlight the diversity of ideas and the diversity of efforts, and really celebrate the folks in the cohort. So just keep that in mind. I think it's important to be transparent about what we'll want to say about your work as it's happening. And I'm done, Megan. Thanks.
All right, I haven't seen any more questions come in, so I would just say thank you so much for your time today, and thanks for even considering this. Like, even if you don't apply, it does take some courage to kind of like it. I mean, you all know better than any of us, solving for childcare is flat out hard. And so I think the fact that you are here and thinking about how can we do better for families and for providers across Kansas, like, just kudos to that. Can give each other all a little virtual pat on the back for just you spending your time with us and thinking about it. And it's been so energizing to hear the ideas that have come in to date, and I'm really excited to see those conversations to continue over the next month. So again, if you have questions, if you want to talk through anything that you're even thinking, is this the right fit for you? Again, please put a TA request in. And we look forward to hearing from you. And yeah, thank you all, and enjoy the rest of your afternoon.